Welcome back to America Decides. House and Senate Republicans are trying to move as rapidly as they can through policy and politics, and there's some real complications there to approve President Trump's budget plan. Potential cuts to future spending on Medicaid have emerged as a key, maybe the most important issue in this negotiating process, done almost entirely within the Republican conferences in the House and Senate. Significantly, this week, House Speaker Mike Johnson appeared to rule out some of the most aggressive options Republicans were considering. But conservatives within his conference still calling for deep cuts. Here with me now, Chiquita Brooks-LaSure. She served as the administrator for the Centers for Medicare and Medicaid Services in the Biden administration. Chiquita, it's great to have you here. Thanks so much. I want to play for you sound from Andy Biggs, Republican of Arizona, Chip Roy, Republican of Texas, about the future of Medicaid spending. And I want you to evaluate it on the other side. Let's play that.
There's ways to get to the savings. FMAP is real fundamental reform. What's happening now is you're paying a higher rate of return for able-bodied, working-age people more than you're giving to the vulnerable population of children, pregnant moms, the disabled.
You shouldn't have the able-bodied getting more than the vulnerable. You shouldn't be having people on Medicaid getting more than Medicare. You shouldn't be having the people who should work, can work, getting benefits without working. You shouldn't have the ineligible getting benefits if they're, in fact, ineligible. And you shouldn't have the scam that is being able to be perpetrated by virtue of the provider tax gaming that they do.
So there was one acronym in there. Washington is riddled with acronyms. FMAP, that is Federal Medical Assistance Percentage. That's a percentage states receive. Medicaid is a federal-state partnership. Some states receive more than others. But, Chiquita, just to set that up, clarify, evaluate what you just heard from those two Republican members of the House.
So we heard a couple of things, and one of the criticisms is that states are getting paid different amounts for different people. Medicaid's always been a shared role between the federal government and the states, and states need support from the federal government to cover people. But humans, like people who are covered by the Medicaid program, they're not getting paid. We're not paying them differently if you're low income or working. We pay for services. We pay for the care that people need, and the federal government pays a share of that cost. And let's be clear about who we're talking about when we talk about who we're covering in the Medicaid program. We're talking about some of the lowest income people in this country, most of whom are working, are in school, or are exempted because they have some kind of health condition. That's who's on the Medicaid program, or the middle class, where you have a mom, a dad who's in a nursing home, wants to be at home. You have a kid with developmental disabilities. You have autism. Your kid is born with a very serious disease, and they need an organ and transplant, NICUs, children's hospitals. That's what we're talking about when we talk about the Medicaid program.
So the FMAP, the assistance, has a floor of 50%, but some states receive up to 77%.
Yes.
There are several states above 65%. I'm going to list off a few of them: Louisiana, Alabama, Mississippi, Georgia, South Carolina, Kentucky, West Virginia, Idaho. All Trump states.
That's
all
right.
Very strong Trump states. All 65% or higher. What are the implications of these conversations Republicans are having about reductions in future Medicaid spending for those states?
Well, that's the thing. FMAP is really meant to be how much can your state pay. So FMAP is largely determined by the population and how much money your state has. So some of these conversations, and of course we'll have to see what the numbers look like, could really devastate some of the places.
The upper range is $880 billion over 10 years.
That is going to be devastating to states across the nation.
How about rural hospitals?
Rural hospitals in our country are on a knife's edge. They are barely making it. I spent so much of my time talking with rural hospitals who are really struggling. There are so many of them that are closing. There are parts of this country where you now have to drive 2 hours to deliver a baby. That's because they are struggling. And if we want good health outcomes in our country, like Medicaid pays for almost half of all of the births. We need to make sure that people have access to care where they need, and that is certainly in rural America.
What are the other arguments on Capitol Hill among House Republicans in particular who are looking at Medicaid? Even the Wall Street Journal editorial board is that during the Biden administration, which you were there, there was, according to them, excessive or reckless expansion of eligibility and programs provided under Medicaid. And those costs simply must be restrained in the future.
I disagree strongly. I would say a couple of things. First of all, every administration needs to look at waste, fraud, and abuse, and we did too. And we took a lot of steps to make sure that states are spending their dollars well. But expanding eligibility, I would say we have learned from COVID-19 what happens when people are not covered in this country. It hurts all of us. Medicaid is key to our economy. And yes, we did work to make sure that we lower the red tape to get people who are eligible. And again, many of these people are working. You can get Medicaid, and it's wrapping around your employer-sponsored insurance, but sometimes your employer coverage doesn't pay for some of these critical things. Medicaid, for example, covers much more comprehensive coverage for children, and again, for our seniors and people with disabilities.
Chiquita Brooks-LaSure, former head of the Center for Medicare and Medicaid Services. Thank you so very much. I appreciate it.
Thank you.